Hi guys, my name is Jamil and today we will discuss about the pheochromocytoma, which is a disease of adrenal medulla. Pheochromocytoma. Pheochromocytoma. First, we must know that what is this pheochromocytoma, how we give this disease name pheochromocytoma. Look at this. We have four words: pheochromocytoma. Four words. First, pheo. Pheo mean darkens. Pheo mean darkens. Chroma means cells. Sorry, chroma mean color. Chroma means color. Cyto mean cells, and oma mean tumor. Oma mean tumor. So what will be the definition on this world? This is the adrenal medulla tumor, because this is a disease of adrenal medulla. So adrenal medulla tumor. Adrenal medulla tumor. This is the adrenal medulla tumor, which darkens the cell. Which darkens the cells of adrenal medulla. So this is why this disease named as the pheochromocytoma, because in this case there becomes adrenal medulla tumor which darkens the cell. Pheo mean darkens, chromo mean color, cyte mean cells, and oma mean tumor. So now, what happens in this disease? In this disease, there is an increased production or increased blood level of catecholamines. Catecholamines hormones. What are these catecholamines hormones? Catecholamines hormones are epinephrine plus norepinephrine. These two hormones named as the catecholamines. What happens in this disease? In this disease, there is a more production of catecholamines. Catecholamines are epinephrine and norepinephrine. First, we will see that what happens in case of normal. After that, we see that what is this disease. This disease we have discussed. Then causes. After that, normally what happens after that? Causes. After that, diagnosis, and after that, symptoms, diagnosis, and then treatment. First, normally what happens? Normally, what happens? When there is a fight or flight situation, there is a stress on our body. When we are walking on a road and alone, and we see a big dog, then there is a stress condition on our body. When there is a stress condition on our body, sympathetic system will be activated. Sympathetic system will be activated, and this sympathetic system will give signal to hypothalamus. This hypothalamus will secrete the corticotropin releasing hormone, which further act on the pituitary glands. Then pituitary glands secrete the ACTH hormone. Then ACTH hormones will act on the adrenal medulla. And in the adrenal medulla, cells are present named as the chromaffin cells. Basically, this ACTH will cause the stimulation or activation of chromaffin cells. When chromaffin cells will be activated, then these chromaffin cells will produce the catecholamines. What will produce the catecholamines? Now catecholamines have been produced, and catecholamines are the sympathetic system neurotransmitters, or we can say that hormones. Then these catecholamines, which are catecholamines? Epinephrine plus norepinephrine. These both will act on our body to overcome this stress, fight or flight. So what will happen? It will cause the increase of blood pressure and plus heart rate. It will cause increase of blood pressure and heart rate. Second, it will cause the dilate of our eyes. All sympathetic system functions will be controlled by these hormones. It will cause the dilate of eyes. Third, more blood flow to muscles, because in this case muscles have to perform their work. We have to fight. If we have to fight, then we need more energy to muscles, more oxygen to muscles, because muscles have to perform their functions. So muscles will perform their functions through more blood flow. Fourth is the more glucose production. When glucose will increase, then it clearly does mean that when glucose increase, our energy will increase, because in case of sympathetic system, we need more energy. For fight or for flight. So this is the normal case of catecholamines. What happens when there is a stress? We see the pig talk, then it activates the sympathetic system. Sympathetic system will give signal to hypothalamus. Hypothalamus will secrete the CRH hormone, which causes the stimulation of pituitary glands. Pituitary glands will secrete the ACTH hormone, which will act on the chromaffin cells of adrenal medulla. Then chromaffin cells will produce the catecholamines, or epinephrine and norepinephrine. These epinephrine and norepinephrine are the sympathetic system neurotransmitters. Then it will cause the increase of the blood pressure, cardiac output, also increase the heart rate of our body, and also cause the dilation of our eyes. It will cause the blood flow to muscles, because muscles have to work even in fight, even in flight, and they also need glucose to perform their sympathetic function, fight or flight. So this was the normal things happen in case of adrenal medulla hormones catecholamines. Now we will see that this is disease, why there is a greater production of catecholamines, what are the causes of this disease. Now we will see the causes of this disease, catecholamines. So causes of PHEOCHROMOCYTOMA. What are the causes of PHEOCHROMOCYTOMA? The cause is the tumor on adrenal medulla. When there will be a tumor on adrenal medulla, then chromaffin cell production will be uncontrolled. Chromaffin cells uncontrolled growth. The uncontrolled growth of chromaffin cells will cause the increase in size of adrenal medulla, or the chromaffin cell size will be increased. When the size of chromaffin cells will increase, then they will produce more and more catecholamines. They will produce more and more catecholamines, and catecholamines are epinephrine and norepinephrine, which are the sympathetic system neurotransmitters, because when increase the size, it will produce more catecholamines, produce more epinephrine and norepinephrine neurotransmitters, which will act on the sympathetic system and will cause some symptoms in our body. We will see the later symptoms in this video after causes. These causes may be genetic. These causes may be also the genetic. Second thing, these causes may be genetic causes because of their father and because of their mother. And this disease often happen from early to middle age. Because of genetic disorder, because this disease also may be the genetic. These were the two causes of the PHEOCHROMOCYTOMA. So what are the symptoms which are being appeared after the more production of catecholamines, epinephrine or norepinephrine? So now we will see the symptoms of PHEOCHROMOCYTOMA. What are the symptoms of PHEOCHROMOCYTOMA? The first symptom will be the greater blood pressure, because of the more production of catecholamines, more production of epinephrine or norepinephrine. They will cause the more increase in the blood pressure. There will also increase the heart rate. There will also increase in the heart rate. Second thing, what is the function of catecholamines? Catecholamines' function is to increase the glucose level also, and they will increase the glucose level too much in case of excessive production. So it will cause the hyperglycemia. It will cause the hyperglycemia. So this was the third cause. After that, fourth one also, it will cause the anxiety or stress. Anxiety or stress, because catecholamines are the neurotransmitter of sympathetic system, so it also causes the anxiety or stress of our body. These were the some symptoms showed by the pheochromocytoma. Also, maybe the frequently sweating, because these hormones are the sympathetic system neurotransmitters. In case of sympathetic system neurotransmitter, sweating is also controlled by the sympathetic system. Once sympathetic system will be activated, then it clearly does mean that there is an increased production of catecholamines. When there is an increased production of catecholamines, it clearly does mean that they will also activate the sympathetic system. Sympathetic system is being activated, and it will also cause the sweating, and this sweating is frequently sweating. These are the symptoms of pheochromocytoma. First one is the increase of the blood pressure because of the more production of catecholamines, epinephrine and norepinephrine, so more activation of sympathetic system. Next is also increase the heart rate because of sympathetic system. Third is the more production of glucose, hyperglycemia, because we need more energy. In this case, when there will be more energy, then there will be more production of glucose. More production of glucose, it will cause the hyperglycemia. Fourth one will also cause the anxiety and stress. Why anxiety and stress? Because anxiety and stress are the functions of sympathetic nervous system. When the sympathetic nervous system will be more activated, then there will be more anxiety and more stress. Fifth one is the frequently sweating. I have already discussed. The sympathetic system causes sweating. When the sympathetic system is more active, then it will cause the frequently sweating. So these were the symptoms of pheochromocytoma. Now we will discuss about how we can diagnose the pheochromocytoma. So diagnosis of pheochromocytoma. In case of pheochromocytoma, we will take the urine test over 24 hours. First, we will take the urine test over 24 hours. What is this? Why we take the urine test over 24 hours? If there is a more production of catecholamines, then these catecholamines will be excreted out to the urine. So what we will do, we will check the catecholamines levels. Catecholamines level. Why we check the catecholamines levels in urine test over 24 hours? Because if there is a more production of catecholamines, then these catecholamines will be excreted through the urine. So if there is a more production of catecholamines, so they are being excreted through the urine. So we will check their concentration in the urine. Also, first in catecholamines, we will also check the metanephrines. First, we must know that what are these metanephrines? Metanephrines are the metabolic products. These are the products which are formed by the breakdown of catecholamines. Breakdown of catecholamines. When there is a more production of catecholamines, obviously catecholamines will be breakdown, and their breakdown will cause the production of metanephrines. When there is a metanephrine present in our urine, it's clearly confirmed that there is a more production of catecholamines. So catecholamines already we have also confirmed from urine test, catecholamines more and metanephrine has also been more, so it's been confirmed that the disease is the pheochromocytoma. There is a more production of catecholamines. So when this has been confirmed that there is a more production of catecholamines and more production of metanephrines, then what will be the next step? The next step will be its CT scan or MRI of the adrenal medullary glands. What is that? That is the CT scan and also plus the MRI to confirm that there is a malignant tumor, a benign tumor on the adrenal medullary gland. So we will first confirm that there is an increased production of catecholamines and increased production of metanephrines. After that, we will take a step for confirmation that there is a tumor. We will take a CT scan or MRI. So through this, it will be confirmed that it is a pheochromocytoma. So after the confirmation of the pheochromocytoma, through the diagnosis, first diagnosis was through the urine test. We will calculate the catecholamines and metanephrines. When it will confirm, then we will take its CT scan or MRI, and second is the blood test to control the metanephrines. So next, what is the treatment of pheochromocytoma? What is the treatment of PHEOCHROMOCYTOMA. The treatment is a real just only surgery because it is a tumor and tumor is only removed with the help of surgery, and this surgery is named as the adrenalectomy. Adrenalectomy. What is this adrenalectomy? What we'll do, in the adrenalectomy, we will remove the tumor. We will remove the tumor from adrenal glands in adrenalectomy. What happens in adrenalectomy? Maybe unilateral and maybe the bilateral. Unilateral, maybe the bilateral. What is this? Unilateral and bilateral. In case of unilateral, we will in case of unilateral, we will remove the tumor from one adrenal medulla gland, but in case of bilateral, we can remove the tumors from both glands, both adrenal medulla glands. So it was the surgical remove of the tumor. It is the treatment of PHEOCHROMOCYTOMA. What is this? Adrenalectomy. Before adrenalectomy, we have to take some steps. Because it is a surgery, but already in case of PHEOCHROMOCYTOMA, our blood pressure has been increased. First, we have to control our blood pressure. How can we control our blood pressure? So, steps for the safety before 3 weeks or 10 days of our surgery. 3 weeks or 10 days before the surgery. What we have to do before surgery, before adrenalectomy, what we have to do? We will give the patient alpha adrenergic blockers. Alpha adrenergic blockers. When we give this disease will block the action of the epinephrine and norepinephrine on the blood. It will block its function on the heart. This disease will block the function of epinephrine and norepinephrine on the heart. When it will stop the function of epinephrine and norepinephrine on the heart, that it will not cause the increase of blood pressure, so blood pressure will be controlled. Blood pressure will be controlled. When blood pressure will be controlled, then we will avoid. Why we control the blood pressure? Because during adrenalectomy, during the surgery, we can face the hypertensive conditions during surgery. Because during surgery, if there is a high blood pressure, when surgery takes place, then there will be most loss of the blood. So what we will do before 3 weeks or 10 weeks before surgery, we will keep the adrenergic blockers that will block the action of epinephrine and norepinephrine in the heart. So how the blood pressure will not increase, and blood pressure is controlled. Then we will we have overcome the hypertensive conditions during the surgery. So this was the treatment of PHEOCHROMOCYTOMA. So thank you so much, guys.